Hi, I'm Adam Henley, registered nurse and founder of Consortia Care, and today I'll be sharing 6 tips on how to speak to someone living with Alzheimer's disease. The default stance for someone living with Alzheimer's disease is to seek safety from their communication in order to compensate for different communication deficits such as word finding ability and memory loss. This helps them to feel in control of social interactions and creates a safe distance for communication, which limits the intensity of interactions so they can avoid things like difficult or invasive questions which they may not know the answer to. A consequence, though, of this behavior is that the person with dementia will experience increased stress from trying to control others, where they must push people away from them in order to maintain control in some circumstances. These actions can produce negative emotions, especially when combined with things like arguing and distancing from others. And in turn, many people, like their caregivers, may not come to understand their actual needs. Many dementia behaviors are very similar to normal adult behavior we see in day-to-day life. For example, in 2017, this photo made the rounds on social media with Connor McDavid, a hockey player, arriving at Edmonton International Airport to an overjoyed couple who saw him coming out of their gate. They immediately latched on in what Connor later described to a radio interviewer as a death grip he couldn't escape from. Of course, Connor likely could escape from this grip, but it would feel rather rude to pull away from something so familiar and inviting. The use of a grand invitation is the most effective strategy to shift initial emotions towards a more positive state and draw attention to you before you attempt to communicate with someone. And in dementia, this is a critical step, as many people with dementia may be absent and not notice your presence immediately. This helps to make your startle or surprise a very positive experience that is less stressful for them. We've all had instances where people speak above us, both figuratively and literally. It often occurs to children and people living with dementia. What many people living with Alzheimer's disease will describe is an experience where people no longer feel they need to come to their level. They often will continue to stand while they're sitting or speak to them like a school teacher would speak to a student. This in itself can create animosity and stress in communication. It's highly recommended when sitting with someone to try to be at eye level, at a safe distance from the person living with dementia, or when standing, using a side-by-side approach. Avoid blocking or having a confrontational posture. In this photo, you'll see that the two people are actually sitting by side, which produces a level of connection that is different than standing in front of one another. And this is a side-by-side approach that's actually recommended for people living with dementia. In using the prior two approaches, many people will find that they feel rejected, or the person with dementia will feel overwhelmed. And in fact, many people living with Alzheimer's disease are overwhelmed by a successful approach. Don't take this personally. It's not you, it's them. In the sense that many people with Alzheimer's dementia are overwhelmed by the uncertainty and unpredictability that communication brings. If they've cut themselves off from others successfully as a way to seeking safety, then giving space, in a sense, will continue to give them a sense of safety in their environment. It's recommended to try exiting early and reapproaching later if someone is quite agitated after an initial introduction. Even after a successful introduction, many people living with Alzheimer's disease will still be suspicious, especially if they have not met you before. Consider asking them to make choices for you, picking things that are meaningful but not too stressful. Usually inconsequential options are best. For example, if a waitress or waiter wants to invite you to sit at a table at a restaurant and they only have the patio open, they'll often indicate, "Let's sit on the patio. Do you mind picking one of these tables? Which one do you prefer?" You can use the similar approach in talking to someone with Alzheimer's dementia. For example, asking them, "What chair should I sit in? Is this one good, or do you want me to pull up that chair and bring it close by?" Or you could even ask, if you're both walking together, "What table did you want to sit at? Is this one good or that one?" Of course, using language that promotes autonomy is very powerful. Instead of saying "you should" or "you do," you could use language like "do you mind if I," or "can I try," or "how about we," or even "what do you think about us blank?" These all can actually produce a sense of choice and promote autonomy for someone who struggles to feel a sense of independence, and it can immediately build a sense of trust so that you can communicate better with less barriers. One of the biggest things that you'll have to come to expect is that a person living with Alzheimer's disease is likely to be suspicious of your intentions. Many people speak to them with a specific agenda, and they come to them with multiple questions and then leave. It's important to acknowledge this experience because in talking to someone with Alzheimer's dementia, you may choose to use one question at a time, building up over time. I often say this is about going with the flow. It's about a conversation and not an interrogation. And usually, when people begin to withdraw or close themselves off in conversation, it's because they feel unsafe from your questions. Acknowledge that your questions are invasive and start with general open-ended questions and see where the person takes you. Try to enter their world and follow up with very reminiscent questions that help them to explore the meaning in their world, one question at a time. This is one of my favorite communication strategies. Speaking in a clear and rhythmical tone can be quite powerful. But if done incorrectly, it can also lead to further distancing and blockages in communication with someone who lives with Alzheimer's disease. We see this happen a lot when people speak in a patronizing tone, as if they're a child, where someone with dementia may latch onto this and feel like they don't actually truly think they're smart enough to speak to them normally. What I propose instead is to speak more like a beatboxer or like you're speaking a Shakespearean soliloquy, using the power of rhythm as well as intonation to focus on the aspects that you want to communicate. Focus on creating a positive sentiment so that you're remembered as someone who is welcoming and inviting. If you sound serious and have a negative tone of voice, you're more likely to be seen as threatening. And they may misinterpret your questions and conversation as someone looking to gather information as opposed to trying to connect. Find your rhythm over time, and in doing so, try to create engaging and interesting speech that any person would find interesting. You'll find over time that this often presents in a natural style of speaking that only you can emulate, and others would find it very difficult to copy what you do.